Welcome to the Breast Cancer Podcast. I'm breast surgeon, Dr. Deepa Harvey.
And I'm Monica Brooks, a breast cancer advocate.
And we are both breast cancer survivors.
We're here to talk about all things breast cancer.
From surgery to survivorship, we know firsthand the challenges a breast cancer diagnosis can bring.
We are here to tackle topics that impact our lives. Let's get started. Okay, welcome, Chrissy, to the Breast Cancer Podcast. We're so excited to have you here as a guest to pass some very helpful information along to our listeners as far as what to expect when getting a nipple tattoo and questions you get asked quite often that could help our audience make a decision whether it's right for them. So maybe just do a bit of an introduction, who you are, what you do, and then we'll get started with some more questions.
So my name is Christina Siegel. I go by Chrissy. My nickname is the Nipple Fairy.
That's so cute. Yeah.
I love that.
Which I love. I think it's super adorable and it's very endearing to me. About me, I've been a registered nurse since 1996. I have about a decade of hospital critical care and oncology experience, and about a decade of plastic surgery nursing experience. I did 9 years in an academic medical center and 1 year in private practice. And it was in the academic medical setting that I was introduced to nipple tattooing. I'd never heard of that before. I got my job there. And I started Living Story Tattoo in 2015. So I've been tattooing since then.
I wasn't familiar with nipple tattoos.
Yeah, I wasn't either. And I was actually just before the show, I was telling Monica, we see patients after surgery, then at 4 months follow-up, and sometimes at 1 year follow-up, and then they get transitioned to our mid-level practitioners. And unfortunately, I don't see them back by the time they have had the tattooing. So oftentimes I don't get to see the tattoos, but I was telling her how grateful I was that you share them on social media. And so I can at least see the transformation, and it just looks absolutely incredible. So
well, thank you. Yeah. The community really needed this service. Prior to 2015, when I started my business, really nipple tattooing was only done in a medical setting. It was either done by the surgeon or maybe some of their staff. As you know, Dr. Harvey, when you're a surgeon, you like to be in the OR, right?
Right, right,
that's
exactly.
That's
my niche. That's my, happy place.
Yes, exactly. And so, and that's where you put all your training and all your heart and soul into being in that operating room. And it's kind of like a tattoo artist, they should do the same, right?
Yes.
I really look at the tattooing as art, body art. It's just instead of doing a decorative piece, it's doing a nipple. So I kind of had to step away from nursing completely in order to devote myself 100% to tattooing, because it's really hard when you're doing tissue expander fills and pulling drains and calling in scripts and running clinic and doing everything else. You can't be 100% developing anything. So prior to me starting, it really, the community didn't have anybody like that.
Mm-hmm. Yeah. And I love that people come from all over to see you, but our listeners are really, they're international. We are in over 70 countries. So one of the first questions I have is, what do you look for in a good nipple tattoo artist?
The first thing that I tell people to look for is pictures. A tattoo changes through its lifetime. So, it's going to look one way when it's fresh. It's going to be red and swollen and irritated, and you're not going to be able to really see high contrast and definition between the colors tonally on the tattoo at that point. And then it looks one way when it's healed, and then it looks another way when it ages. So there's definitely kind of like the lifetime process of a tattoo, but you want to see healed pictures. So at least taken, a couple months to 6 months after would be ideal to see what that artist is capable of putting in the skin and getting it to stay in the skin.
How do you know who you're going to has the experience they need to imprint something that's going to be on your body forever?
That's really important. So you want to, when you go to ask the artist, you want to kind of research on their page what kind of experience they have listed, because there's always a lineage when you think about being a tattoo artist. Like, who did you apprentice with? Who did you train with? Who did you get certified by? So it's kind of a red flag for me if I go to look at somebody's webpage and they don't have their lineage or who they trained with, their accolades on their website. So you want to really just ask people, who did you train with? And then you can always look up their trainer too, as well. Did you train online? Did you train in person? Unfortunately, with COVID, We
Yeah.
saw a boom of online tattoo training, but it's common, and it's a lot more common than people think. And those online trainings, you can walk in and see a certificate on someone's wall, and you're like, oh, my doctor went to Harvard, they have a plaque on their wall. It's not the same. So it's really important that you ask if they had hands-on training. You cannot learn how to tattoo online. You can learn theory. You can learn fundamentals of tattooing, the history of tattooing. You can talk about needle choices and theoretically how to tattoo something. You can talk about case studies. That's all great. And that's a base knowledge, like about surgeries. Yes, you can learn that online. But to be able, before you would ever touch a breast, you need to have a master of tattooing be right with you. So you can watch that needle bounce. You can hear the change in the machine. You can watch her stretch. You can see her movement. Like, it's so important that you have that. So make sure that they've done in-person training with a reputable person that you can research online. And then I always ask too, how many nipple tattoos have you personally done? Everybody starts out somewhere, right? Everybody has to start out somewhere. And the tattoos that I'm doing today are much different than the tattoos I was doing as a nurse. And they're different than what I was doing in 2015 and 2016 and you always want to learn and get better and evolve, but you learn a lot tattooing by time in the skin.
So what would one expect? Like, I'm sure one of the first questions is, when can I get my nipples tattooed?
Oh, yeah.
And I also want to mention, these are 3D nipples, and maybe talk about what that is.
So a 3D nipple is really you're using art with the principles of light and shadow to create an illusion that there's actually a nipple protrusion off of the skin, but in reality, it still remains flat because, we don't do surgery. We can't make anything appear on the skin, right? So we're just really tricking the eye to see an illusion that there's a nipple there. And then I kind of compare doing a realistic tattoo of a nipple as like a portrait tattoo. Essentially, portraiture is just that. It's light and shadow creating structures of the face to recreate a human's image, but we're not making a face, we're making a nipple. So it's kind of like a portraiture.
And is that a 4D tattoo?
So 4D is kind of a newer term to me personally. I've seen it popping up on the internet. And from what I can gather, people say 4D when the doctor does like a nipple reconstruction, where they kind of gather the skin and make the actual surgical protrusion. And then I would come along and tattoo the areola around that protrusion and then up onto the nipple reconstruction to kind of just give it more depth and more realism. But topographically, they have that protrusion there. So with a 3D nipple, it's just flat skin. So you come in, I essentially am drawing on you with permanent tattoo ink, and you leave with a nipple.
Amazing. I've seen a lot of your work on social media, and my favorite thing that you do is you run a Q-tip over the 3D nipple, just because it looks like it's protruding, but it's not. And it's like, it's done so beautifully that it looks so real. So going back to my question, I was going to ask, like, what do we expect going to an appointment? How long do we have to wait? Maybe just kind of start with those questions.
Sure. So how long do you have to wait? That is probably the number one question that I get. And it's because people have such an excitement wanting to get the finishing touch for their breast reconstruction. Sometimes people call me and they're like, I just had my nipple reconstruction, and when can I get on your schedule? Right. And then other ladies who, they kind of wanted to take a break. They've been really overwhelmed and they don't want to be poked and prodded and go to the appointments and stuff. So they kind of want to wait. The best thing that I can tell somebody is it's always different per individual. A good starting point is about 6 months after your last surgery. It kind of depends too on, like, did they cut through if they're doing a tissue expander change to an implant, did they cut through the original mastectomy incision? Sometimes they do. Sometimes they go through the inframammary fold below it. So that original mastectomy incision is quite healed, it's been on down the road. So in that situation, I'm not going to be tattooing over the IMF. I'm going to be tattooing over the middle part of the breast. You're healed as long as your swelling's gone down and your implants have kind of settled into place. I would tattoo somebody in that scenario like maybe 4 months after their last surgery. If I have to go across an incision that's been reopened, then 6 months is a good place to start. If your incision that would need to be tattooed over top of is red or dark, if it's raised, then it's probably not completely always all the way through the immature phase of a scar tissue. Scars can remain immature for, like Dr. Tawari says, for like 18 months up to 2 years. So everybody's different. Some people, they heal right away and their scar is great and it's very fine and very flat. And other people, depending on their body makeup, just are different.
How
So
do
I
I
always
know, like, if it's an immature scar? Like, is it because it's red? Like, how does someone determine whether their scar is like ready to be tattooed over or not?
Yeah. So Dr. Tawari, and I'm going to keep quoting him just because he's like, who I was his nurse for a very long time, right? So a lot of this, I'm probably like regurgitating things that is really his knowledge, but that is kind of one of the signs you look for. And he always says scars tend to look worse before they start to look better. So about 3 months down the road, you might notice that your scar is looking a little bit different than it did right after surgery. And then it has to have a period of calming down. So what can help with that? Scar massage, silicone scar sheeting, things that doctors can recommend to help with your scar. If your scar is really dark or red, it's probably still immature.
Got it.
That's one way. I tattoo over scars every day, every day, typically. In the past, if I've tattooed over a scar and it was still a little bit immature, when people come back for their second appointment, you'll notice that maybe that scar is a little bit flatter. Maybe it's a little bit because there is a technique in tattooing called dry needling, which is kind of like micro needling in the cosmetic world. And it's the physical mechanical breakdown of that scar tissue by the needles going in and out. So sometimes tattooing over top of a scar can be a beneficial thing. But as far as taking ink and absorbing it and retaining it, an immature scar is going to struggle with that.
That makes sense to me.
Yeah.
It makes sense. Yeah. And also people of different color heal differently too. And the browner, darker skin people tend to have keloids. I'm sure you run into that, and problems
Absolutely.
of doing tattooing over the keloids can be problematic as well. So
absolutely. And that's kind of another ball game where you tell people, I can tattoo over top of this. I really always look. And if I feel like I can't, if someone's skin is too thin, if the scar is too raised, too angry, too immature, not ready, I'm very honest and I tell people, because I would want somebody to be like that with me. And with the keloids, you can kind of reactivate those, and sometimes they can get worse because right, that keloid occurred due to a trauma from the skin, right?
And you're causing trauma again.
100%. Yeah. So I do try to really make sure that my patients are really informed about the process and things. I do tattooing in a 2-step process. So when people come to me for their first visit, I don't tattoo anybody that I haven't spoken to. I don't do the whole book online, I'll meet you at your appointment. I don't do that at all. So I like to talk to people. So either, they can come in for an online or for an in-person consultation. We can do Zoom like this. That's I started doing that after COVID. That was new. Or we talk on the phone and then you send me pictures. Some of our older clients, they don't have access to technology or they're not comfortable with it. So, it might be really important that they come meet me. They never thought they'd be getting a tattoo in their lifetime. They're a little bit scared of me. They don't know what I'm going to do to them. So whatever's going to be the best way for you to meet me and that I can evaluate you, it works for me. So after the consultation, then we would schedule your appointment for your tattoo. Or if you're driving or traveling and we've done a Zoom, then when you come to me, the first hour of our meeting is a consultation, basically. So we do all the prep work, just like when you're getting ready to paint a room. So we have to talk about size, shape, placement on the breast to achieve the best symmetry, details that you want in your nipples. It can be a little overwhelming. And then mixing up color. And so all of that takes the better portion of like an hour to really do this thorough consultation and get the groundwork laid.
Some things you don't think about until you're there is, should I have a picture of my nipple color, or how will she know? So is that something you recommend for people to do maybe before a mastectomy, just to make sure they have some idea of the size, the color that would be helpful to you?
Yes, that I'm a super visual person, and nipples are not easy to describe verbally. It's just a really hard thing. So I tell people one thing that can kind of take away from the overwhelming choices and the anxiety that goes along with picking your new nipples would be to kind of do a little homework before you come to see me. And then that way, you can see, like, for instance, if they look in my tattoo gallery and they would say, gosh, I really like the protrusion of the 3D nipple on this one. but I like the color of the areola on this one, and I like the Montgomery glands on whatever they bring me, right? And then I can kind of morph it into their own special nipple, because I try not to do, quote, like a cookie cutter nipple for every single person that walks in the door. We want them to be special and different. And the worst thing that I could do would be like, you look down and go, oh, I don't like that at all. That's terrible. So I really do want a lot of input. This is your body. You are taking these breasts home at the end of your appointment. They do not belong to me. They are your breasts. So it's really important that you get your style and things that are going to be very pleasing to your eye. So yeah, it's really good. Or if you take a pre-mastectomy photo. So if you have a picture of your original pair, then that's great too. Sometimes, you know, the shape and size of your original nipple won't translate to your reconstructed breast, you know, but for color and the nipple protrusion and the details and things that you were used to seeing for the majority of your lifetime, we can for sure incorporate that into your new tattoo.
I love that.
Yeah. And I don't know how many people actually take pictures of themselves before surgery, Chrissy, but physicians, we do, surgeons, we take pictures before. And so patients can always ask their surgeons for pictures.
What a great tip.
Yeah. It just dawned on me as she was saying that, because a lot of people really, you know, some may not feel comfortable taking pictures, but the surgeon should always, whether it's breast surgeons or plastic surgeons, should always have before pictures for color and, you know, different things like that. What I'm hearing from you is, number one, you're an expert in this because you do this all the time and you're great at it. I can tell from seeing my patients, how they look. And number two, the great communication that you have with these patients. You're setting up expectations, you're educating them, you're helping them to see what it's going to be like, and you're setting realistic expectations. And I think that's a big thing in, you know, being a successful, whatever you do, whatever art that you're, you know, good at. Like for me, yes, being a surgeon, being in the OR, that's where I want to be. If I can do that 5 days a week, I'd be happy. But I also enjoy the bedside aspect of taking care of patients too. But yeah, I mean, just doing the same thing over and over again, just being an expert, I think is the bottom line to be good at anything.
I agree. And I agree with your comments on Chrissy. And Chrissy, what I love about you is you take this very seriously.
Yeah.
And you're also really easy to hang out with.
Yeah.
You know, so one of the things I did as far as getting ready for this is I went to see Chrissy while I still had my nipple.
Oh, okay.
And she was able to do a color match right there on the spot. And
do you want to tell our viewers when you did that, or what part?
Oh, sure. Yeah. So I don't remember. I just, for our listeners and our viewers on YouTube, I had deep flap surgery. Yeah. I have been flat on my right side for almost 4 years now. And I still had my left breast. And so I felt like, you know what, Chrissy and I, we talk, and I said, hey, what about, like, could I come in now? Cause I was having my left breast removed also, which was great to have that done. But I said, can you just look at my nipple? Can we get a color? And that's what I did. So I went in, she matched my nipple color so that when I go back, probably in 2024, I'm thinking we'll be ready. Yeah. Like she has a picture and all of that.
But that's such a smart thing to do though. I did not even dawn on me to tell a patient to do that, but that's such a great tip.
Yeah.
Number one, take pictures. Number two, actually go see your tattoo artist beforehand so that they can, again, communication, setting up realistic expectations. And that's really awesome. Great tips, you guys.
Yeah. So I kind of wrote down, you know, Monica's little nipple formula of the inks that I mixed up with her, and I taped them on the inside of my cupboard door. So then that way, when you come, and I kind of have like a little cookbook recipe of like different colors that I like anyway, that I use for people. But that's a really nice way to get the closest representation of what your original nipple was. I tattooed my best friend in the world who had a mastectomy in 2020. And she told me, she's like, listen, I know it's not going to be the same. I'm never going to be the same. She said, but if I can just have a little bit of what I had before, just in the color realm, just see what I had before, just so now it's not a blank slate. And I think that when you talk about like the realistic expectations, you know,
and I think patients would need to manage that expectation. Like you said it beautifully, like once you have a diagnosis of cancer and you have to have things done to you, your body will never be the same. 3D nipples are not but you're going to do your best to get it to what we want it to look like in that 3D aspect and looking realistic. It
all goes back to the fact that when you get told you have cancer, you lose control over everything, right? So, and then to have some control over something, what type of tattooing do I want? Do I want a 3D? Do I want this color or that color? Do you want I have patients who have flat closure and they just want, tattooing of different things, flowers and different things like that. And I love that when I hear about it, I sometimes ask us what they want to, tattoo there because they've thought about it. It's a form of them taking control over their life, after this tragic situation where you get told you have cancer and go through all the surgeries and treatments and so on and so forth. But you play such a beautiful role in that patient's life, give them that power back, essentially is what you're doing. So just know that what you're doing is such a great service to our patients. So
thank you.
I was going to say, Chrissy, you had mentioned 2 appointments are typical for you. So first one, let's say the consultation is done, you know what you're doing. Someone comes in, what would I expect? How long does that appointment typically last? And then is the second appointment always needed?
Yeah. For bilateral tattooing, I normally tell ladies carve out about a 3-hour block of your time. So, again, like I said, the first hour of us being together is going to be all the laying the groundwork. The bigger the size, obviously, the bigger the breast, the bigger the areola, it may take me a little bit longer. And then when we get done, we go over your aftercare instructions and we make your next appointment. The next appointment, I tell ladies, give me about 2 hours of your time. So with bilateral tattooing, you'll have about 5 hours of face-to-face time with this girl. And then with unilateral, I tell ladies, give me about maybe 2 hours, 2.5 hours, maybe for your first appointment. They're hard in both different ways because with the unilateral, I have something I'm looking at that I just draw it, when I'm tattooing it. But the shape and the size and the symmetry and the placement for the unilateral reconstructions can be quite challenging sometimes. And then mixing up the color, that can be super challenging sometimes. So definitely a 2-stage process. With the first visit, regardless if you're bilateral or unilateral, we're establishing everything. So I'm going to do the 3D part of the nipple. I'm going to do the entire areola, and I'll do as much as your skin will let me. So as a tattoo artist, I have to listen to your skin. It will talk to me the whole time I'm tattooing it. And if your skin says, don't touch me, I've had enough, then I have to stop. So I try to really set the expectation that I'm going to try to complete your nipple as much as I can, but if I can't, I can't. And I walk away from it because you can't be stubborn and keep assaulting the skin. It can cause damage. And an unskilled artist, like an untrained artist, an inexperienced artist, they may not know what to look for with that. Then in the second appointment, that's when we even things out between both sides. We add color where your body has told me it needs color. Especially on a scar. Scars can be kind of finicky and resistant to absorbing color. Sometimes they can soak it up more than we think. Sometimes they can kind of repel it. So usually I work a little bit more on the scarred areas, and I always hit the 3D nipple portion more to really pop it out more.
That's awesome. I do have a question. Does the insurance cover this?
It can. So I'm always considered an out-of-network provider simply because I don't have any support staff that works with me. And I can't, as being one person, do all the things that the insurance requires. So what I usually do is I provide the patient with the codes, the CPT codes and the ICD-10 codes based on what they've told me for their history. And then I give them my MPI, my tax ID, my RN number, and I have them call their insurance company on their own behalf and see if that company would be willing to reimburse them the cost of the nipple tattoos. I've seen it all. I've seen some insurance companies be like, no, we won't pay a dime. And then other people get full 100%, reimbursement. I've seen the whole gamut. I would say typically people get around 70% if they're going to get reimbursed. Sometimes what you pay me, an insurance company will allow you to put that towards your in-network deductible. If you live outside of Columbus, your insurance company can't find a provider on your list that does this service within a 50-mile radius of your home. Many times they will substitute me as an in-network provider rate, and then they'll allow for reimbursement that way. So that's a nice thing. I always ask people, where do you live at?
Yeah. I would imagine that question gets asked a lot about insurance. That patients want to know. What are some other questions that are common with people that come to see you for tattoos?
A lot of people will ask me, what are my post-tattoo restrictions? The healing period, it takes a minimum of about 2 weeks. So for the first couple of days, your skin is open, just like if you fell down and scraped your knee, right? Mildly scraped your knee. And that's the time when you can really be susceptible to an infection. So you want to make sure that the area is kept clean and it's not exposed to dust, dirt, bacteria, pet hair, whatever, we want to make sure that it's very clean. So you'll be kind of seepy, like if you popped a blister and that sticky yellow fluid that you see, right, that's going to kind of seep out for the first couple of days. Then that dries up and then you will start creating some scabs. The more frequently you wash the tattoos in the first couple days, the less opportunity that fluid has to take hold to make a big scab. So you want to wash it frequently in the first few days. And then usually between day like 3 to 7, you'll start peeling your scabs off, and they come off. They usually look like a little like mascara flakes. And then they're usually all gone between day 7 to 10, sometimes 14 days. But when all of your scabs have gone, then I have people use an Aftercare cream and a little nonstick telfa pad. Sometimes I use Tegaderm type of products called Tattoo Derm. It really depends. I've had some patients have allergic sensitivities to adhesive, so I'm not a super fan of that, but I will use it in the right situation. But a lot of the times I'll use telfa, and that's just a nonstick pad to wear inside the bra or a camisole just to keep the tattoo protected away from any friction from our clothing. And then when you heal up and you come back, the aftercare is really the same, but usually it goes a little bit quicker because there's less work to do on the second time around.
Mm-hmm.
So I do tell people during the healing period, avoid strenuous, heavy, super sweaty workouts that are going to, increase bacteria and stuff in the area. Walking is fine. If you have a job, like I tattooed a welder at Honda, I'm like, you have a cool job. But she's like, I'm 100 degrees of, of sweating in my job. So I said, it's super important that you go wash and clean during that. And then the other thing is to avoid immersion into a body of water. So showers are great, but you don't want to get down into any type of body of water. So like coming into this time of year when people are starting to take vacations, I just tell people, let's appropriately plan for your tattoo, because I am the last person in the world that wants to take your vacation from you. Like I do not want to ruin anybody's vacation fun. So in between the 2 weeks or the two appointments, I have about 10 weeks pass. That lets that 2-week healing period take place. And then we turn our skin cycle, cell cycle over like every 28 days. So it lets you go through a couple of those cycles. And then when you come back, my eyes are going to see exactly what your cells have trapped and retained. And so then I know what to add for the second visit.
I think cancer has taught me to plan for those types of things. Like, when is my surgery going to be? So I don't miss out on summer. And the same thing with the tattooing. You don't want to risk ruining, like you said, a vacation or your summer plans or whatever it may be.
This is something new for me in the tattooing community. Before, hardly anybody had nipple sparing mastectomies, right? And now they're becoming more common.
Yes, right.
So sometimes ladies, they may topographically like keep their areola and their nipple after the mastectomy, but it might lose color. So sometimes, sometimes ladies come to me and I will tattoo color back into that nipple areola complex. It's the same idea with tattooing. I just have to use, I dilute my ink differently depending on what skin type I'm working on. And I use different needles and different techniques. So it's a little bit more of a tedious process. It takes a little bit longer because the areola tissue is glandular, but the same process as far as like the 2 visits and all that kind of stuff in aftercare. And then sometimes with the nipple sparing or even a brush reduction, like if you're, or a lift on the contralateral side, right? Like your non-cancer breast that they do a surgery on, sometimes you can have a little bit of tissue loss sometimes. So in that case, then I would tattoo to make it appear that tissue is still there and it's got color uniformly around. So then that way, when you look in the mirror, you do see very similar nipples on both sides.
That's awesome.
Wow. That's such a great thing that you're doing too, because you're right. The color does fade over time. So
and one thing for me, it was kind of like a learning process because for the longest time, I was just tattooing, the 3D tattoos or the 4D over top of the nipple reconstruction. And I hadn't had a whole lot of experience with a native areola, whether or not it had so I've got quite a few physicians here in town that don't necessarily do breast reconstruction anymore, but they do cosmetic breast surgeries with reductions or augmentations, mastepexies. It's so common to have a problem with healing with the nipple. It's a lot more common than people think. It doesn't mean that your surgeon was bad. It doesn't mean that they did something bad to you. It doesn't mean that you didn't follow your healing instructions correctly. It's no one's fault. It's just sometimes there's a blood supply interruption to that tissue. So tattooing can be a really great thing to help have a normal appearance to that nipple afterwards. And now I feel like I do probably out of the 5 days a week I work, usually one day I'm doing something to a native nipple.
And also I was thinking as you were talking, the 4D tattooing, I've been doing a lot of Goldilocks mastectomy, which is essentially removing the breast tissue, but using the skin to fold and give them a little bit of a breast mount. And we've been trying to preserve the nipples as much as possible when it's oncologically safe. But when the cancer is right behind the nipple, we can't do that. So we've been removing the nipple. But I'm just thinking I can create that nipple just with the extra skin. I've taken courses for that. And then I'll send them to you for tattooing so they can have a 4D
I
tattooing.
love this.
That would be
So yeah,
awesome.
this podcast has been such a learning venue for us, for both of us, and someone who does this on a daily basis. I'm just so impressed that I continue to learn every single day and have such a privilege of meeting people like you who are making such a huge
Oh,
impact in this community and
Yeah.
in this world. So
Absolutely.
thank you.
Well, Chrissy, one of the last questions I have is around the cost and what would someone be prepared to pay? Do you feel like if they had the double mastectomy and you did both of their nipple tattoos?
So obviously that, is going to change depending on what part of the country that you live in. I did do a comparative search here recently in the last few months, right around the start of the year. What I found is you're going to want to be ready to hear the price of starting about like $500-ish. Now, depending, there are certain parts of the country like California, they could charge $1,800, $2,000. It really depends. Most of the artists that I've seen, they charge one price and that bundles the 2 visits together. And that's what I do. I take one price on your first session. On the second session, when you come back, you don't owe me anything at all. But for me personally, I did raise my prices as of January 2023. So my new price for bilateral tattooing is $700, which includes both visits. And my price for unilateral tattooing is $450. Yeah.
It's like when you think about the cost though, like what you were giving women,
yeah,
that confidence to
priceless.
feel more like, yes, it's
it's priceless. Yeah, what you're giving women is priceless.
Yeah.
And I really think it's extremely reasonable rate.
When I talk to people on the phone, depending on where they've had their surgeries done at, I do participate in some charities as well. So one of them is the Heirs Foundation. If I talk to them and they say, gosh, that cost is really prohibitive to me, I just simply can't afford it, I've got all these other, financial burdens, then I refer them to the Heirs Foundation. They can apply online for a grant. Then the Heirs people contact me. I send an invoice to the company. They send me a check. The patient doesn't have to pay me anything at all. Also, if you are an Ohio Health patient and you are in the same situation where the cost would be prohibitive to you, I don't want to ever turn anybody down for the inability to be able to pay. So I always offer people the opportunity to as well have a funding provided for your nipple tattoo if you're an Ohio Health patient, which was really nice. The Columbus Aesthetic and Plastic Surgery Group here in town, every year in October, they have a huge Caps for the Cure fundraiser. And all of that money goes to services that insurance could deem as cosmetic, but they're very important. So one of them is cold capping. The other one is they have a girl in their office named Marcella who does microblading eyebrow tattoos for the ladies who've lost their brows. And then the last person that receives funds is me for the areola tattooing. And I'm so thankful for them. They raise money for exactly the women that are in need for this service. Yeah. I'm so thankful. And I'm happy to offer that to my Ohio Health patients.
That's amazing,
Wow,
Chrissy.
that's
Thank you for everything that you're doing in the community. Yeah. How can people learn more about you? You talked about your website. Let's talk about your social media handles. Where can we learn more about you?
So I have 2 websites, livingstorytattoo.com. That's my basic website. You'll find all my information there. Prices are listed, my photo galleries. I also have the nipplefairy.net. That's kind of an informative website for survivors to go just to learn about the tattoo process. So I have a lot of blogs and information on there about tattooing in general. So, and interviews and stuff that I've done is on that website. My Instagram is at Living Story Tattoo. My Facebook is Living Story Tattoo.
Are you on TikTok?
I am on TikTok. On TikTok, I'm the Nipple Fairy.
Okay.
Nice.
Wonderful. Yeah. Chrissy, thank you so much for your time and lending us your knowledge. And I definitely think this will help our listeners and our viewers to make a good decision that fits them and to know what to expect. So we appreciate you being on the podcast today.
Oh, thank you for having me.
Thank you so much for taking the time.
Yeah, I appreciate you guys so much.
Bye-bye.
Bye. Well, that was so informative and helpful.
My goodness. I've learned so much. Yeah. And as you can tell, Chrissy is so passionate. She's so committed and she wants to do the right thing for the patients. She has a great desire to help them. I mean, the whole package, I think.
Yeah.
you
And I
know,
think the fact that she's a nurse is amazing, and
Yes.
how it evolved into what she's doing today. And you can tell she really cares
yeah,
about the
Yeah.
work that she's doing, and
Right.
how it does feel good to feel more like yourself
Yeah.
again. And even we've talked
Yeah.
about my deep flap surgery. It's not the same, of course,
Right.
but just to feel more like me and to look more like me,
Yeah.
like, nothing like, it's such a good feeling.
Yeah.
So
Yeah.
we do hope this podcast was helpful to
Yeah.
you.
It was great. It was really great. And again, Chrissy is one of those, not just a nipple fairy, but she's
Yeah.
also an angel. I
She
think.
truly
So,
is. Yeah. Thanks for listening today to this podcast. And until next time,
Take care.
bye.
Bye.